Neat, huh? That simple. Just a little opening. You think you're kinked or plugged up, like I said, it's just bends and tight spots are where your medicine will plug it. Like on this type of tube, or some of these tubes that have a clamp that you can tighten, have a tendency to tighten too much, and you get a little kind of a pinching in the tube there, if you can see that. It has a tendency to capture any sediment or particles in your formula, and they build up there like blood coagulating in your veins. Especially if you're on a slow flow, like a 24-hour pump system, you need to be back flushing now and then to clear the blockage. Every couple hours sometimes. Depends on the thickness of your formula. Formulas run anywhere from like, on the average, people start on a 1.0 to a 1.2 calorie per milliliter formula. In that formula, you not only have your food that gives you the 1 to 1.2 calories per milliliter, you have fiber. And the fiber is the stuff that has a tendency to settle out and do the blocking. No big deal. You know, you can clear them. Coca-Cola, if you take an ounce of Coca-Cola, that'll fill up a tube, and you just use your syringe, you pump your Coca-Cola in, and it'll fill the tube. Just let it sit for a minute. Don't pump it all the way through. Just let it sit for a minute, and then give it a short blast. Like take an ounce, pump in 3/4, 2/3 to 3/4 of it, and then let it sit for a minute. And then give it a little burst, that last little bit, and then say another ½ ounce or an ounce to flush afterwards. And that generally cleans it. Coca-Cola works better than anything else to eat loose any blockage that you have in your tube, sediment that has stuck to the sides or built up on the inside. All your tubes will, over time, like this one was 2 months, it had that much. This one was a year and 2 months, so it's basically turned black from it was about that white. This part of it just kind of browns over time. But, you know, no big deal. Very easy to care for. Very simple. Just basically, it's just a straw. Not the hole in your stomach is not, you know, you're not going to sit there and bleed to death out of it. It doesn't work that way. And in a very short amount of time, you're going to start forming what they call granulation buildup. If you get on top of that with burning it away with silver nitrate sticks, it has a tendency to scar over and become a natural opening, and you don't even feel the tube. I'm not kidding. You won't feel the tube at all, especially after a couple of days. You won't feel anything. It's not painful. You know, somebody hits you in the stomach, that's going to hurt for a minute or two, but so would your stomach if you got hit without it. But there's absolutely nothing to fear about, nothing to panic over. If you have a problem with your tube, they are so simple. There's an easy answer. And knowing what your tube looks like, you know, what type you have, It'll help you to understand what might be wrong if you do have a problem. You can always look up your type of tube. If you don't know what type you have, you can call the radiology clinic that put it in, or the doctor that put it in, and ask them what brand and model of tube you got, so that you can look it up and you can get some pictures of it and understand everything about that tube. They're all the same. All the G tubes are the same. They're different styles is all, but they're the same thing. Just a straw that goes into your stomach cavity, inside of your stomach. J tubes, there's a lot of different types of J tubes. J tubes that go through your stomach and into your small intestine. J tubes that go through your lower abdomen and into your large intestine, or directly into the intestine, small intestine or large intestine, whatever, and are attached and anchored. That's another area altogether. If you can avoid a J tube by using one of these, that's good. The J tube that goes in through your stomach and down into your small intestine is not so big of a deal. It's about as simple as these. It's just putting them in. It takes a little bit longer, and they have to work it through, because there is a muscle at the end of your atrium. You know, it closes down. It doesn't let anything out of your stomach until it's been cooked in the gastrin, and then it lets a little seep through, and keeps opening and closing and letting it feed through at a certain rate. Okay, they have to work it through there and on in. But other than that, there's nothing that you need to fear about these things. They're simple, they're easy upkeep, and just imagine, no more dishes to wash. It's great, especially if you live alone. But there you have it. Oh, you got all kinds of adapters you can get for them, valves and extensions with clips. There's all kinds of goodies. But there you have it. The simplicity of a feeding tube. So what's to fear? These really are the nicest one. If you can handle silicone, you'll probably like this, because you don't have to be taping up the long one to the side of your stomach like I do. And you don't have to worry near as much about the end cap coming open on you. I mean, I have that happen a lot of times. It finally harden up and not get good. And that's why I have learned to use a piece of tape over the top. And that pretty much keeps me under control. Now, about the size, this is the last thing. The size of them, if they have done it and upped the size, it's not that critical. There's really no big need to go up in size. If your tube you've got an infection, is generally the reason they'll go up. Your tube has got infected and tissue has eroded away, and you're leaking past the tube. Don't worry, it's no big deal. It just kind of runs out, makes a mess around your gauze, or if you don't catch it in time, it messes up your shirt. But that's no big deal. Just soak it and wash it right away. But put the gauze on there. Just use a little bit thicker amount of gauze. Make sure you get that down, and then tape it good across, and so it keeps up there and is not being flexed over. And then bring this around, tape it down on the side of your stomach. But if that hole has been made larger for some reason and you're getting that leakage, if you stay careful for a couple of weeks, it takes about 2 weeks, having something through the hole. Taking the tube out altogether, it'll be closed up in 24 hours. Then they'd have to punch a new hole, and you don't want to do that. Just keep it for 2 weeks. Keep it snug. Try not to move it around. When you pull it up to clean, make sure you have enough room on your thing so you can pull it straight up and clean and not have to pull over sideways. So you can pull straight up, clean around it, put it back down, taper down, and keep it snug. Just be real careful for about 2 weeks. That hole will close down around the tube naturally and fit the tube again. And you can be back down to a good fitting on a small tube again. Just stay with a lightweight tube. The bigger the tube, the heavier they get. And finally you'll want to be on one of these. These don't. Some of these do, as you get bigger, have bumpers, but silicone I can't deal with. It'd be nice to have that if I could, but I can't. The silicone causes such a rash and irritation, and then it gets infected. That's why I use a barrier cream, and everybody actually uses barrier cream. The stomach acid that seeps out, you don't really feel it, but it doesn't only turn the tube brown, it'll turn around your stomach, around the opening over time. Your skin starts to get yellowed and slowly brown there. That's why I use that heavier gauze, that coarse gauze, and grind away at it, wash it real good. Because it's getting sunburned or suntanned from the acid, from the gastrin in your stomach. So you're getting a gastrin tan. Anyhow, there you have it. Tubes. There's nothing technical and nothing critical. No fear, no panic. Easy to deal with. No more dishes to wash. Ain't that fun? Enjoy!